Yeah, big question. But let's just let's take one main part of it, which I've seen it's caused problems in the past many times. If somebody is critically ill in hospital and you're working with the family around that person, you want to talk about the particular disease or sickness. Talk about the disease and sickness. Don't talk about the individual. In other words, if, say, somebody has a heart attack, explain what heart attack is. Don't keep referring to the patient because that could upset people, especially if there's people there who are in avoidance relationship to understanding the disease and sickness of that particular person. Now, they might still be there and they might want to know what heart attack is, so you explain heart attack. And then if you're going to talk about the person themselves, you would ask, is it okay that we now talk about this patient's particular relationship to the heart attack? And some people might excuse themselves from the room. But you only go there when you've given permission, and they might say, oh, we don't want to do it in front of the patient, or they might say, can we have a meeting somewhere else? Then you follow people's lead. You don't just assume that it's okay to talk about the patient. A number of people I know in the past have made this mistake and got themselves into real bad trouble with rallies. So talk about a disease or sickness. Don't refer to how that affects the particular patient at that time. Make sure that that's a separate occasion that we talk about. And it can be the same with a person with a disability. You can talk about what causes disabilities and so forth. And you need to separate that from when you talk about the particular condition of that patient and get people's permission. Is it okay that we talk about X, Y, Z or so-and-so? Is this the right place to do it? Is this the right time to do it? Have we got the right people here to talk about that? Sometimes you might be surprised if you say, who should I, if I say I'm a doctor and I want to tell the group that's concerned about one patient, who should I be talking with or working with to talk about this patient's condition? It might be a young person that puts their hand up. It could be a young person in the right relationship that puts their hand up. The kutara, the grandchild. Go with that person because they are the one in the right relationship to control organising a meeting in the family to talk about a patient's condition. Yeah, I hope that's a bit useful.